A school-based health center is essentially a doctor's office that goes into a school, and it provides the same kind of services that you can find in a pediatric office. Our doctor's offices, however, have always had mental health staff, so we're integrating the practice of primary care and mental health. So you will see physicians, nurse practitioners, mental health staff, potentially a child and adolescent psychiatrist, and then support staff that are helping them to see students on the school campus.
How many parishes have school-based health clinics, and how many students are treated by them?
So we're in 26 parishes here in the state. We have seen about 52,000 children last year, and that amounts to about 150,000 visits or encounters.
What kind of a benefit do these clinics have for the children?
Well, for the kids, we're helping to keep them in school so they can learn. And so for parents, we're helping keep them at work so that they can bring home their paycheck and keep their kids healthy. For the schools, though, we're providing a tremendous support system that is helping students stay in school and learn. Louisiana needs a better prepared workforce. One way to get that is to keep kids in school, and we are one big piece of that story.
Thank you so much for allowing us to be here today. I am here today to talk about an initiative that started in the state of Louisiana in 1987. At that time, the Robert Wood Johnson Foundation was very interested in adolescent health, and so they chose 26 cities across the United States. Baton Rouge and New Orleans were lucky enough to get a school-based health center. In the wisdom of the person who was running the site here in Baton Rouge, he opened 2 instead of 1. So school-based health centers basically have 2 outcomes that we're always looking for. How are we impacting the child's health? But also, how are we helping keep them in school and helping them to learn? So, did you know that 97% of the time, students who come into a school-based health center go back to class? That means that we're keeping them in school so that they can be better educated. This is one of the things that we focus on because we know that what Louisiana needs is a great workforce. Now, what we've also done, and here in Baton Rouge, we pay very close attention to the students that are receiving mental health services through us, and we look at both their quality of life and their academic outcomes. In both cases, 70% of the time, students that go through the therapy with our social workers and our child and adolescent psychiatrist show that they either improve their quality of life and/or they also improve their academic standing. So we are showing and proving with data that we really are keeping kids in school so they can learn. So you might ask, what is a school-based health center? Well, what the Robert Wood Johnson Foundation knew, and what we also know, is that the adolescent population really doesn't have great access to medical care. And so what's come into being is to simply take those services to school. Why is that important? Because parents can't get to providers during the hours when they're working, and so the only time that they have left to go to a medical provider is usually through an emergency department, which is the most expensive health care that you can pay for. I want to bring Ryan up. He's going to do some more conversation about school-based health centers. I want to also mention, though, I met Ryan after Hurricane Katrina. His entire adolescent medicine practice relocated up to our school-based health centers, and we were very happy to have him. Ryan.
Thanks for allowing me to be here today and speak on behalf of the Louisiana Assembly for School-Based Health Centers. So one of the most frequent questions I get asked is, what is a school-based health center? So a school-based health center is actually a medical clinic at a school. It's not a school nurse. It's a doctor's office on school grounds with a nurse practitioner, physicians, and a social worker or behavioral health counselor there. In Louisiana, we have over 65 clinics spread across 26 parishes, providing care to over 32,000 students last year and over 140,000 visits to school-based health centers in this state alone last year. Each of those clinics, by requirement from the state, is a public-private partnership. That partnership includes a match to state funds. That's a unique requirement for school-based health centers here in Louisiana. Through this next map, you can see that, again, these school-based health centers are spread throughout these 26 parishes, but are typically in rural and densely populated urban areas. These are areas where our poorest students are oftentimes not accessing needed care, and this care is critical to students throughout both of those types of regions. So what types of services do we provide in these clinics? So again, school-based health centers as medical clinics on school grounds provide the same types of services that you would expect to see in a general pediatric office. But they're also uniquely positioned to provide those services to youth and have them return back to class and prevent parents and guardians from having to remove themselves from work and their productivity at work to get their kids into healthcare. So they keep their kids in school and parents at work, but they're also providing a high level of care that include following state-specific and national guidelines for the types of services that they provide. One of the examples of this, and I'll pause here to kind of tell a story, is our approach to sports physicals. Again, these are adolescent patients. Oftentimes they're coming in to get a physical exam for participation in athletics, and we typically in school-based health centers like to provide comprehensive physical examinations that include psychosocial and medical evaluation, and then provide their sports medicine paperwork back to them. And we not too long ago had a story of a student that was a 3-sport athlete, came in to get his sports physical, quickly discovered that it wasn't going to be a 10-minute process, but he completed that comprehensive physical exam in that professional medical setting, quiet setting so you can listen to their heart and lungs, and a place where you can talk about things confidentially. During that visit, we discovered first that his blood pressure was significantly elevated. And then when we did his cardiac or heart exam, discovered that he had an abnormality there. On further evaluation, he was first told that he couldn't go back and participate in athletics at that point until a complete evaluation occurred. And through that much more intensive evaluation, it was discovered that he actually had a fairly significant cardiac issue, but one that could be well controlled with medication. He's now on 3 medications, but he's also back to playing safely those 3 sports. And this typically doesn't happen for many of our patients.
We are located in 26 parishes. We are throughout the state, all the way from Shreveport, Lake Charles. We go down to Bogalusa. We're up in Alexandria area, Gina. We're pretty diverse throughout the state.
What kind of an impact will the state budget cuts have on these clinics?
There will be a reduction in services to students on school campuses. Sites that are full-time may be reduced to part-time, and some sites, unfortunately, may close. Every time we lose access for children and youth to health services, that's going to cause a decrease in graduation rate. It's going to cause an increase in emergency room visits by these children. Overall, not a good economic picture for the state of Louisiana.
How many school children would be affected by these budget cuts?
In terms of the number that are on all campuses, that number is probably around 75,000 children have access to school-based health centers.
What would you like to see happen?
I'd like to see DHH to restore the budget cut and work with the Louisiana Assembly on school-based health care to help us. We understand the state has a $1.6 billion deficit. We understand that. What we're saying is we cannot take the magnitude of the cut in 6 months, but if we have time to prepare and help from DHH and our local partners, potentially we can overcome this.
I'm a pediatrician with a specialty in adolescent medicine, and I currently serve on the board for the Louisiana Assembly for School-Based Healthcare, and we provide advocacy and work with school-based health centers across the state of Louisiana.
As a doctor, what kind of a benefit have you seen from these school-based health clinics?
Well, both in my practice and looking at clinics across the state, we see that kids are getting access, teens especially, to healthcare services that they're not receiving other places, and particularly their access to behavioral healthcare services. So having on the school grounds a social worker or other behavioral health specialist that they can access anytime during the school day and also get their medical services provided during that time as well.
What kind of results have you seen from the care that's provided at these clinics?
It's overwhelming. The fact that students can get routine and acute medical services and get back to class means that they're not missing their classes and that they're able to stay in school. It reduces dropout and reduces costly ER visits and other unnecessary healthcare costs.
I have been a family nurse practitioner in the school-based clinics for the last 12 years, and it has just been the most rewarding experiences being able to actually be there first line to assess kids, adolescents, to be there and provide, especially the emergency care. One of my specialty areas is asthma management, and so often I find kids that either don't have an inhaler, have an expired inhaler, is not on the right medication. We have emergency medicine at the school-based health center, so we're able to then just get that child the asthma medicine or the EpiPen or the emergency medicine. And I think one of the biggest impacts we've made is keeping these kids from emergency room visits. So that's been the most rewarding.
What kind of an impact would these proposed budget cuts have?
It'd be devastating. In our New Orleans area, we're still just recovering from the impact of Hurricanes Katrina and Rita, and we lost all of our school-based health centers at that time. Now we're just getting back up on our feet, and this would mean probably that many of those clinics would close.
What would you like to see happen? What's a good alternative?
I think probably the best alternative for school-based health at this time is a restoration of those proposed cuts and some free thinking about what we could do to increase and shore up our sustainability over the long term, including being able to bill for the behavioral health services that we provide and are very critical.
What would you like people to keep in mind regarding this issue?
So I think the most important thing to keep in mind is the fact that these clinics have been operating for the last several decades in Louisiana with quite a bit of support from the community and are keeping kids in school, keeping them healthy, and keeping parents and guardians at work.
If people have questions or like more information, what should they do?
I think the best thing to do is to contact the Louisiana Assembly for School-Based Healthcare, and you can find us online.
And the website is?
It's www.lasbhc.org.